Okay, we're going to go through a physical therapy treatment session. Patient identity has to be checked. Time in, time out has to be at a minimum of 40 minutes. This is how you can use a template to add to this visit to simplify. Medical diagnosis and PT diagnosis does need to be filled out. The medical diagnosis you will find in the yellow sticky. PT diagnosis you are creating, if you are a physical therapy assistant, you will find both of these in the physical therapy evaluation. Homebound status needs to be checked yes, as we are providing home health. Patients are all homebound. Criteria 1 is and/or, so only one box needs to be checked. You need to specify. Here are some examples. We can provide these to you. Criteria 2 is and, so both of these boxes need to be checked, and again, you need to specify. Vital signs need to be filled out. A minimum, you need to fill out prior. I would suggest doing during or and post. You need to do blood pressure, position side, heart rate, respirations, and oxygen, along with room air and rate. If the patient's vitals are out of parameters, you can add comments here, such as MD notified of hypertension. Subjective information here, along with a COVID statement. That are the questions you asked the patient. Pain assessment needs to be filled out. If the patient does not have pain, you can check no pain. You do need to fill out increased, relieved by, and interferes with if the patient is experiencing pain. Range of motion strength needs to be addressed. If you did not address it this session, then you can check this, and this information goes blank. Objective information needs to be filled out. This information does carry over from the previous visit. I do suggest updating this with each and every session with the training and interventions performed. So bed mobility, transfer training, gait training, other training. You also need to address the patient's posture. You need to address the patient's balance. This is a drop down. These are check marks, fairly easy to address. Test and measures does not need to be addressed with each treatment visit. If you choose to do so, that's fantastic, but not mandatory. This is where you will fill out the training exercises you performed with each and every visit. I also suggest that these are updated with each and every visit, be it you add new ones or you update the reps, the minutes, but this needs to be updated to show progress. So impact of exercises on functional performance, filled out here. If the patient did have a fall, this is where a fall log is created, very rarely, hopefully. Assessment, at least one checkbox of these three needs to be addressed with each visit, and the patient's verbal understanding and demonstrated understanding, be it patient or caregiver, the tools you used, home exercise program, progress to goals. You need to address 2 of these boxes with each session. So either the patient did make progress or the patient did not make progress, and also needs continued intervention because summary of patient's overall performance this visit. This is information you will need to update with each session. And then the plan, so what you will perform next visit. And we need to check the discharge planning box. If you want to fill out information, that's great. If not, you can just check the box, because we as clinicians are always planning to discharge the patient to independence. That is our goal. So we always check this box. This is where you add care coordination. If there's no need to contact skilled nursing or physician, just add PARS intake team, because something needs to be here with each session. If you wanted to create a template, you can check this and fill out information, contact guard, treatment, and then you save it, and then that creates a template for another treatment session. So if you want to save your note, you save it. If you want to submit it, you fill out your password here and you submit, and that is it.